the children of our world. They need a voice, and that's what's missing for children. I oftentimes will say to a parent, you sit over there, I want to talk to the child. And a parent kind of backs up and looks at me like, who are you? And in adolescent clinic, we make it official. I do a parentectomy. I remove the parent from the room. The plans for the medical consultation group really started long before when we finally got going. When I first heard about it, I literally ran up to my boss, Dr. Dreyer, presented my case that I wanted nurse practitioners. Part of their training, part of their work is to teach, and this role is a teaching role.
Social workers, our child protection specialists out there, we're kind of doing work in the medical field and trying to understand the medical language without a background at all, without medical backgrounds, and having nobody to advise them, to make recommendations for them, to even just interpret documents for them, was for me a huge gap.
Concerns were recruiting people who would be insane enough to do this, right? Because you're taking clinicians and putting them all by themselves in a field office to be then always ready to do something.
I was the very first physician to be hired by ACS full-time, and the question they asked me was, why did I think ACS would need a medical director? And I said, because you're involved in so many issues that are medical and mental health in nature, yet you do not have a medical person as a touchstone in the whole organization.
The medical consultation program for child protection is based at NYU Bellevue. The staff are all certified through NYU Bellevue. They staff 16 or more sites to provide services to the workers. Those services include consultations, participation in case management, and offering of any other information that might be helpful to the worker to understand what is happening to that family. Medical diagnoses are very complicated many times, and to try to distill that into a useful terminology is their primary goal.
I was introduced to the medical consultants in my early years of being at ACS. My supervisor was the one that directed me to meet with a medical consultant to discuss any cases that I may have that parents would have a medical diagnosis, to get clarification on how we would go about servicing this parent and understanding the diagnosis.
Well, the CPS can avail themselves of a consult by sending us the consultation request form. In my office, I get it via email. So they complete the consult request form after they're given a directive, either by their supervisor or their manager.
What do you suggest? Are there any other resources that I should, provide to the parents? Any other recommendations? What do you think I need to do next?
Okay, so these are the controller medications. Various forms, and for particularly difficult to control asthma, Symbicort and Advair are used. So if you notice that a child is on Symbicort or Advair, they're difficult to control.
Okay.
You need to understand what exactly the doctors are writing down on the questionnaires, medical questionnaires that you send forth to them. You also need to know knowledge for your own self and to also educate the families that you are servicing. Every family is different. You need to understand what he or she might be going through and teach them what you have been taught by the medical consultants as to ways to care for their own child or children when he or she is sick.
Okay, while the child's at school, the school nurse will have a spacer and an inhaler for the child. The inhaled steroid is taken every day at home, morning and night.
I have developed at least 30 PowerPoints, user-friendly, attractive PowerPoints to educate the staff. I have developed hundreds of single-page educational sheets. I will cut and paste from a reputable source, and I will take everything out of it that they don't need, and always make sure there's a graphic on it.
The CPS worker will go out, and they'll go out with their checklist, for me at least. This is where I write down the things, these are the things you want to go to the home with. Do they have the medication? Yes, we've checked off that because they've given me the medical records. They have a hematologist appointment in a week. Perfect. Already signed up with Cohen's Hematology Oncology Department. That means they're going to get tons of literature. I'm going to also give you some literature. You can take that to the home. And so those are the type of things that we do as a medical consult.
Another aspect of the consultant is joining us sometimes in the child safety conference. I remember where there was a time that Geraldine sat in on the conference. We were doing a removal. The parents were hysterical, crying, didn't understand why. So the child was diagnosed with failure to thrive. And Geraldine, what she did was help the parent understand what that means. When the parent spoke to the doctors, they not using language that is simplified. So the parents are confused and really not understanding what is going on. So Geraldine was able to step in. She was able to comfort that parent as well and let them understand what role they needed to take, you know. So that in itself is her stepping out of the role for a minute as a consultant and being human, but yet still able to identify with the parent.
So a CPS worker came to us about a 15 or 16-year-old Hispanic male who was obese, had mental health issues, and diabetes. He refused to leave the home for anything. When I and the mental health consultant discussed this, we decided that we would do a home visit. The mental health consultant tackled the mental health issue, and I tackled the diabetes issue. And I think we made a difference. I think the child understood what we were saying, but I really don't think we got to him until I decided to say to him, from my past experience as a medical provider, what are you interested in? What do you want to be when you grow up? And he said, I want to do computer programming, computer technology. I said, that's perfect. You think that just by sitting at home and playing with your computer here, you're going to be able to be successful in that career? No, you're going to need formal training. You're going to need to go to school, graduate from high school, get into a college program or even just a technical program for computers. And the only way you're going to be able to do that is if you go to the doctor and let your pediatrician give you a full medical assessment to see how you're doing with your diabetes. And I said to the worker, I said, are you going to make an appointment for him to see the doctor? I want you to make an appointment. She said, I will make that appointment. And then I looked at him and I said, listen, I just walked up 5 flights of stairs to come and see you, only you, because that's how important you are to me. If you don't go to that appointment, it's going to be an issue if I have to walk back up these 5 flights of stairs. And he laughed, and I was so happy because we hadn't got him to really laugh. So he laughed. And you know what made me the proudest? He went to his pediatrician appointment.
The other thing that you develop, as I said, relationships. So what Geraldine has done, remember, every Friday we would have tea. So this sort of helped the CPS decompress a little, and staff as well, you know, and the consultants really liked it. So it was something we enjoyed and look forward to.
The other night, a CPS was going out at 9 o'clock at night to make visits in the cold. And I want to cry for her. She's going out. She doesn't know when she's going to get home. She doesn't know what she's going to be exposed to. She may have had to make child care arrangements.
They do the most difficult job I can ever think of. As I tell our residents, you go out to that house, you knock on the door, and have somebody say, you're going to take my kids, aren't you, lady? Right? See how you like that. Right? And so they, knowing that, still wanted to do the job. When I knew this program was working was when the workers came to the Child Protection Center at Bellevue and referred to the nurse practitioner as our nurse. Possessive. We won.